Hi, my name is Tyler, and today we're going to do a head-to-toe assessment. Hi.
Hi.
We're going to go over your medical history, your surgical history, your social history, family history, and your medications. So now that we've cleared up all of that, I'm going to verify, obviously I've already verified my patient, but can you tell me your name and date of birth?
Samantha Conaway, 4287.
Perfect. Now I'm going to wash my hands, don gloves, and close the curtain to give you some privacy. Okay?
Yes.
All right. So basically what I'm going to be doing is I'm going to be inspecting, palpating, percussing. Well, I'm probably not going to do much percussing, but I'm going to be looking at you, touching you for tenderness. We're going to be doing some range of motion. We're going to test your cranial nerves. We're going to test pretty much everything, okay? It's a head to toe.
Okay.
All right, so I'll explain it as I go.
Alrighty.
Okay, so the first thing I'm going to do is observe her face and head and neck for symmetry. Okay, because we're going to start at your head. So her face looks good. She's groomed appropriately. She's clean. So I know she takes care of herself. I'm going to palpate the head. Any tenderness?
No.
Okay. I'm going to inspect the head, inspect the hair for any lesions, any nits or lice or anything like that, and I can see that she doesn't have any. I'm going to take a look at your ears, Samantha. I'm just inspecting your skin for any kind of abnormalities or drainage, and I don't see any. Does your ear hurt?
No.
Do you feel like you have any issues with your ears?
No.
Okay. Now I'm going to come to your face, and I'm just going to palpate. I'm going to palpate your temporal artery, which both are very strong. Okay, I'm going to touch your sinuses. Tell me if this hurts. Does that hurt?
No.
No tenderness?
No.
Okay. Now I'm going to test your cranial nerves. Okay, we're going to start testing cranial nerves. So I'm going to have you close your eyes. We're going to test cranial nerve 1, which is the olfactory nerve, and I want you to tell me what you smell.
Vanilla.
Okay, so her cranial nerve 1 is intact. Next, we're going to go through cranial nerves 2, 3, 4, and 6. Oh my God, no, all over me. Now what we're going to do is first we're going to have you stand 20 feet away. I'm going to have you read that chart, and that chart is, you're going to read the lowest line you can. I'm going to have you cover one eye. Okay, can you read the lowest line you can?
Buylocal.
Okay, now go ahead and cover your other eye. I'm going to have you read the lowest line you can.
Buylocal.
Okay, and now go ahead and read the lowest line you can with both eyes.
Buylocal.
Okay, she was able to read line 8 with one eye, with each eye and both eyes at once. Do you wear contacts or glasses?
No.
Okay, perfect. So there was no vision abnormalities. If she were to have a difference between eyes, at least 2 lines, there would be an unexpected finding. Okay, next I'm going to have you do this chart, and I'm going to have you read with both eyes the lowest line you can.
ABCDE.
Okay. Do you have any issues with vision?
No.
Okay. All right. So now I'm going to dim the lights. I'm going to have you look at that doorknob handle over there. Okay, now focus. I'm going to have this patient focus for about 30 seconds. And I'm going to come in. When I look at your eyes, I want you to follow my pen light. And I want you to not move anything but your eyes, okay? Follow my pen light. Okay, and our eyes did somewhat cross, and that is what we're looking for. Now, I'm going to come into the sides and just test pupil accommodation, okay? And that pupil did accommodate. And that pupil did accommodate, so they both went down about 1 or 2 millimeters. All right? Now I'm going to test your cardinal fields of vision. All right? which is cranial nerves 2, 3, 4, and 6. All right? So what I'm gonna do is I'm gonna have you look at my pen light and follow my pen light with just your eyes, okay? Ready?
Mm-hmm.
Okay, so she was able to follow my pen light with no nystagmus or anything unusual. She had smooth movements, which is what we were looking for. Next, I'm going to test your cardinal fields of vision, okay? Or I'm sorry, we're gonna do your peripheral vision now, okay?
Okay.
So what I'm gonna do is I'm gonna have you cover one eye, okay? And I'm gonna cover one eye, and you're gonna tell me what number I'm holding up in my hands, okay?
Okay.
I hope they can see this.
2, 3, 1,
Yeah. Okay. Now this one.
1, 2.
Okay. Good. Now we're going to. I already palpated your temporal artery, but now I want you to clench your teeth, and I'm going to feel your temporal muscle, your masseter muscle. Okay. That's good. Now I'm gonna feel for your lymph nodes, okay? So I'm looking for any lymph nodes that are larger than 1 centimeter, and then we'll further inspect them if we find them, but these are your preauricular lymph nodes. I can't feel them, which is a good thing. There's no swelling in your postauricular. No swelling in your cervical. None in your submandibular. Okay, so I can't feel any lymph nodes, which is a good thing. Now I'm going to have you look up, and I'm going to inspect your nose. And it looks like her septum is midline. There is no polyps that I can tell. I'm gonna have you open your mouth. I'm gonna inspect the buccal mucosa, her gums, and her teeth. And I don't see anything abnormal there, okay? Now I'm going to palpate her trachea, which is midline, which is an expected finding, and your thyroid gland, which does not seem to be swollen, okay? So next I'm just gonna palpate the carotid artery. There it is, just one at a time so you don't pass out. Okay, I can feel both. So now what I'm going to have you do is we're going to test your facial cranial nerves, okay? So I'm going to have you smile, frown, raise both eyebrows, puff out your cheeks. Perfect. I'm going to have you stick out your tongue, move it side to side, say ah.
Ah.
Okay, her tonsils look good. They're not taking up much of her throat. I would say they're less than 25%. So that's a good thing. And I already tested your muscles. I'm going to test your TMJ. Go ahead and clench your mouth one more time for me. Okay. Okay, that's good. Now I'm going to have you shrug your shoulders against resistance. Okay, that's good. Now turn your head. That's good. Turn again. That's good. Looks like she's got a good clear sternocleidomastoid. Okay. Now I'm going to do a whisper test. And this whisper test is going to tell me if you can hear properly, okay?
Okay.
So what I'm going to do is I'm going to cover this ear. I'm going to cover my mouth so you can't see it. And I'm going to say 3 words, okay, of colors and numbers. Ready?
Okay.
5, green, 1.
5, green, 1.
Okay, we're gonna do this side. I hope they can see. 3, 6, red.
3, 6, red.
Okay, so that's good. Next, I'm gonna go ahead. I'm gonna do the Weber and the Rene test with my tuning fork. So what I'm gonna do is I'm gonna hit this tuning fork. It's gonna make a vibrating sound, like a buzzing sound. And I'm gonna have you tell me if you can hear it better in place 1 or place 2. Okay?
Mm-hmm.
Ready?
Mm-hmm.
1, 2.
1.
Okay? Do this side, ready?
One.
Okay. And now we're going to do the Weber test. And the Weber test, I'm going to hit my tuning fork. I'm going to put it in the center of your forehead, and you're going to tell me if you hear better out of your left or right ear or in both, okay?
Okay. Both.
Okay, that was good. Next, we're going to do, we did your vagus nerve. Go ahead and open your mouth, say ah.
Ah.
Now I'm going to make you gag with this tongue blade. Okay, so that's good. So, and do you have any issues swallowing or eating?
No.
No? Okay, that's good. So her vagus nerve is intact. Okay, so next we're gonna, I already palpated your carotid. I already had you shrug against resistance. I'm gonna test your range of motion. All right? How does that feel? Does that hurt?
No.
Okay. Shoulder? Does that hurt?
No.
No tenderness? Okay. That hurt?
No.
Okay. Does that hurt?
No.
All right. Now I'm gonna have you close your eyes, and I'm gonna have you tell me where where I'm touching you. Okay?
Okay.
Close your eyes.
Left forehead. Right cheek. Right chin. Left cheek. Right forehead.
Okay.
Right left bicep. Right forearm. Left hand.
Okay. Good. Now I'm gonna have you hold my hands
Oh.
and squeeze. Okay. And that is good muscle strength.
So strong.
That was good. Okay, now I'm gonna have you stand up. And we're gonna perform what's called the Romberg test. Now I'm gonna have you stand with your feet close together, no shoes, and I'm going to have you close your eyes. I'm gonna observe the patient for swaying. She's not swaying. And now I'm gonna have you touch your finger to your nose. And now your other hand. Good. Okay, now I'm gonna have you walk heel to toe. Go ahead. Okay, patient is still not swaying. Now turn around and walk normally towards me. And the patient has a normal gait, no weird swinging of the arms or stumbling. No rigidity, that's good. Now I'm gonna have you come. We're gonna do heel to shin. I'm going to support the patient at this time and during the Romberg test to make sure if she is dizzy, she doesn't fall. All right, so good. So you can go ahead, you can sit down. And now we're just going to check your, we're going to have you do your hands. Coordination. We're going to check your coordination. I'm going to have you flip your hands, open and shut. Okay, finger to thumb. Perfect. Now touch with one of your fingers, touch my finger and your nose. Other hand. Okay, patient can do that in a smooth motion. Next, I'm going to listen to your heart sounds. I'm going to start here I'm going to touch you, sorry. Alright, so that's apical. Pulmonic. Herb's point. Mitral. Here, I'm gonna have your boop. There we go. Mitral. trying to find for your... There we go. Okay, good. So we did heart sounds. Now take a deep breath. Okay, good. I'm going to observe her anterior posterior diameter. And it looks the ratio is about 2 to 1, so that's good. Now I'm going to have you stand up. And can you bend forward?
In this direction?
Yep. Okay, that's good. Any pain or tenderness?
No.
I'm gonna check your spine and just feel for midline spine. Any tenderness?
No.
Can you lean forward just a little bit for me? I'm gonna see that it's midline with no deviation. That's good. Tenderness?
No.
Pain?
Mm-mm.
Okay, nowhere?
No.
Okay. I'm gonna check her arms for edema. Pain?
No.
Okay, there is no edema. Check this arm. No edema. Okay. Now I'm gonna listen to your lung sounds. So go ahead and turn around. Okay. Every time my stethoscope touches you, I want you to take a deep breath, okay?
Okay.
I'm gonna just move your hair. Okay. Sorry, this is like right where I need to be.
I'm sorry.
It's okay. 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 There we go. All right. I'm gonna lift this. Sorry. Can they see this? Okay, well, they sound good. I'm gonna go over here. Okay. Okay. So those are all clear. Now go ahead and turn around and sit down. Now, if she was wearing a hospital gown, I would check her skin on her legs for anything abnormal. But in this case, since she just came for a physical at the clinic and she's wearing leggings, we're not going to do that. But I'm going to test your range of motion on your leg, okay? Does that hurt?
No.
Okay, can you roll your ankle if possible? Okay, does that hurt?
No.
Any problem doing that?
No.
All right, can you rotate your foot out or in? Yep, there you go, that's fine. Up and down. Okay, that's good. I do not see any edema, if you can see. I am gonna check your pulses though. This is your posterior tibialis. There we go. And your dorsalis pedis. I hope they can see that. Oh. There we go. Okay. Thank you. And now your other leg. That doesn't hurt. Can you put your foot up and down and roll it? In and out? Looks any pain?
No.
You ever have any issues with that
No.
foot? Okay. Checking the tibialis. which is right up from the malleus. All right. There we go. Okay. So she's got good pedal pulses. And I'm just gonna check your radial pulse. Let me see. I'm gonna have you turn your arm out. That's a good one. Brachial. That's a good one. This side. There it is. Okay. All right, perfect. Now I'm gonna have you lay down. We're going to look at your abdomen. Here, actually, I'm gonna try to get the camera on a better angle for this. Try to do this fast. Ah! Okay. Can you raise this leg? Just checking hip range of motion. That's good. That's good. I'm going to lift up your shirt now, and I'm going to inspect your abdomen. Okay. Abdomen looks normal. I can't tell anything superficially that looks different. Now I'm going to listen for bowel sounds. Okay? In all 4 quadrants. This is the left lower quadrant. Yeah. Left upper. Yep. Right upper. Okay. Left lower. Right lower, sorry. Yep. There's bowel sounds in all 4 quadrants. Now I'm going to palpate. I need you to tell me if this hurts and I'll stop, okay?
Okay.
Then we're going to do light palpation. Any pain?
No.
No pain?
No.
Okay. I'm going to do deep palpation. That hurt?
No.
No tenderness?
No.
Okay. All right, you can go ahead and sit up. Really quick, I'm just going to have you turn around. And I'm going to have you take deep breaths. We're checking for diaphragm expansion here. Go ahead. Okay, go ahead and breathe again. Go ahead. Okay. So breathing looks normal. This patient doesn't seem to have any issues. Do you have any questions for me?
No, I do not.
Okay.
This was the best physical of my life.